Hi, I'm Dr. Brian Thornburg, and occasionally I'll receive a message from a parent that is so heartfelt that I am just compelled to respond. And I received one of those messages today, and I wanted to read her message about her son and then go through how I would approach this if they were part of my practice. This is for informational purposes only. I don't know this little boy, but I know a lot of other families might be in a similar position because it deals with autism. I wanted to just get this information out there as soon as possible. So this mom writes, Dr. Thornburg, I came across your page from a podcast where you spoke about infant organ development, specifically the liver not being fully developed until around 6 months old. My heart sank because my son was hospitalized at 7.5 weeks old with very high bilirubin and liver enzymes and suspected biliary atresia. He had a HIDA scan with nuclear medicine and then a liver biopsy under general anesthesia, all before 8 weeks old. He ultimately did not have biliary atresia, and extensive testing for many rare genetic disorders all came back negative. They said it was neonatal cholestasis. He's now 3.5 years old and autistic, and I've always felt that this is why. I'm trying to understand how to reverse any damage to his gut and support his health moving forward, but there's so much information out there that it's overwhelming and hard to know the right direction to take. I'm not looking to blame anyone. I'm just really hoping for guidance and wondering if you believe this to be true as well. Also, for context, he is not vaccinated at all. I only had them give the vitamin K shot and ointment in his eyes at birth. First, my heart goes out to you because I know this is a tough situation, and every parent who has an autistic child goes through the same racking of their brain of what could have led to this condition in their child. While unfortunately we don't have any direct answers, we can certainly take some steps that will help your son have hopefully an improved quality of life. And I use functional medicine for this. There's 3 tests I would run. I would do a food sensitivity test. I use an LCAT in my office. And the reason is 80% of our immune system sits around our gut. So if we're eating some foods that are adding inflammation into the gut because our body doesn't like it for whatever reason, and the body's making IgG in response to those foods, then we want to eliminate those foods temporarily so the body can reset itself and then reintroduce those foods so we don't have that IgG response. This is especially important in autistic children because we already know that they have gut dysfunctions. I haven't met an autistic child that doesn't have a gut dysfunction, and so we really want to focus around gut health, as you mentioned in your question. Second test I would run is a GI map. We want to understand everything that's living in his gut. We want to understand the inflammation that's in the gut. We want to understand how he is digesting and absorbing the food. This is also important, as I mentioned, because of the inflammation and the GI dysregulation that happens in autistic kids, because he spent some time in the hospital, and the hospital has some bad bugs there. And while these bugs may not be causing some severe GI distress that a mainstream pediatric GI doctor would be able to identify it, having these bad bacteria in the gut at a small population can still activate our immune system. And so we would want to eliminate this. Also, if he has a dysbiosis of the good bacteria, because you can have too much good bacteria, we would want to correct that. Also, we would get a snapshot of some inflammation markers and see how well he's just digesting and absorbing, which is very important for his well-being. And the last test I would do is a Nutrival test. This is a blood and urine test to look at the metabolic processes happening in the body. We use the blood and the urine to identify the amino organic acids. And the reason that we do these tests is because when we step into the functional world and outside of the mainstream world, we're able to improve assimilation, how well we digest and how well we absorb nutrients. We need the proper gut bacteria in the right amounts to help us digest and absorb this food. And imbalances can lead to leaky gut syndrome, can lead to the food sensitivities and malabsorption, bloating, and nutrient deficiencies. Also, functional medicine helps us improve our defense and repair. This helps modulate immune regulation and the body's ability to repair tissues. It also reduces chronic inflammation, helps reduce autoimmune conditions and frequent infections, allergies, as well as impaired wound healing. The third benefit of functional medicine is energy and biotransformation. We need our mitochondria to make ATP, which gives us energy. So if we are not firing up our body's furnace well enough, then it's hard for our body, if we look at it like a factory, to undertake all of the essential processes that need to happen. And so if there is an imbalance, that could lead to fatigue and brain fog and metabolic disorders. With an autistic child, we certainly want to make sure that their energy is optimized. The fourth is biotransformation and elimination, and this refers to how well the liver can remove toxins and process hormones and move metabolic waste out of the body, because we do that through our kidneys, our liver, and through our skin. It's the only exit paths we get, and it's primarily through our stool that we can do this. And when we have a poor function here, that can lead to toxic buildups and hormone imbalances and chemical sensitivities. Also, communication is the fifth benefit of functional medicine. It allows proper signaling through hormones and neurotransmitters and cytokines, and this improves cognition. And if we have a problem there, that could lead to mood disorders, hormonal issues, neurotransmitter imbalances, and cognitive decline or worsening. Sixth benefit of functional medicine is transportation. This is through our cardiovascular and our lymphatic system. This is how we move oxygen, how we move nutrients and hormones, and we remove waste from the body. And if we have any problems here, this can lead to poor circulation, cardiovascular issues, although that isn't so important with him, but it is something that should be understood so we can just improve all functionality in his case. And then the last and the seventh aspect of functional medicine is structural integrity. This is how well our membranes, our cellular membranes, and our subcellular components work. This helps musculoskeletal integrity and connective tissue and proper barriers such as the gut lining. And any problems here can lead to membrane instability, increased permeability such as leaky brain, leaky gut. And so we need to pay attention to that. As we can see, all these 7 functional systems work upstream from our organs, and they work in every single organ system. So it's really important to take a deep look into all of these areas to improve his quality of life, improve repairing what may have happened from the past, and just move forward. Unfortunately, unlike most parents of autistic kids, we just will never have an answer. I'm glad he didn't take vaccines. We know that the vaccine court has adjudicated that the vaccines have caused autism in the past. And as we see a cultural change, because the court systems represent society, and as we see a change to our society values and how we prioritize reviewing the medical literature, we may see more and more autism cases be adjudicated as a result of vaccines. And I know he didn't take any vaccines, but I'm glad that he didn't, because I think we're going to see more and more associations in that area. Thanks a lot for your question. My heart again goes out to you and for all the families who have an autistic child. Thanks for listening.